One of the most common questions I hear during an ultrasound is, what is that bright spot in my baby's heart? That bright spot is often something called an echogenic intracardiac focus, or EIF. Years ago, finding an EIF often caused a lot of anxiety because it was considered one of the soft markers associated with Down syndrome. Many parents were told it was a small calcification in the heart. Today, we understand it a little differently. An EIF is simply a tiny bright spot that reflects ultrasound waves strongly, usually within one of the heart's papillary muscles. It appears as bright as bone on the ultrasound image, but it does not affect how the baby's heart works. Most EIFs are found in the left side of the heart, although they can also be seen on the right side or even on both sides. In some babies, there may be more than one focus. When I identify an EIF, I don't look at it in isolation. I carefully examine the rest of the baby's anatomy and look for any additional findings. That's important because an isolated EIF is very different from an EIF seen together with other markers. In modern obstetrics, many parents choose genetic screening during pregnancy. When those screening results are low risk and the EIF is the only finding, it is generally considered a normal variant with little or no clinical significance. EIFs are most commonly seen around the mid-pregnancy anatomy scan, usually near 20 weeks. They may be visible earlier or later in pregnancy, although they can become harder to confirm in the third trimester. So if you ever hear the term echogenic intracardiac focus, remember, in most cases, it's simply a bright spot we see on ultrasound, not a heart defect, not a problem with heart function, and when isolated, usually just a normal variation of fetal development.